Welcome to Part 1 of the Injury Data and Needs Assessment webinar in the Pan-Pacific Safe Communities webinar series. My name is Tracy Earle from the Safe Communities Foundation New Zealand, and I'd like to introduce our presenters. Both are from Safer Wanganui. For those of you not familiar with New Zealand geography, Wanganui is situated on the lower west coast of the North Island. Lauren Tamihana has been working full-time at the Wanganui District Council as the Safer Wanganui project leader since 2014. Has been involved in Safer Wanganui since its inception in 2008. Lauren's co-presenter, Sue Stewart, is a community injury prevention consultant with Accident Compensation Corporation, more commonly known as ACC, and has been involved with Safer Wanganui for almost 6 years. Lauren and Sue are going to talk about the needs assessment Safer Wanganui has conducted. Their presentation is entitled, Is Our Ladder on the Right Wall? So over to you, Sue and Lauren.
Kia ora and welcome to our presentation today. My name is Lauren Tamihana. I'm the Safer Wanganui project leader.
And I'm Sue Stewart. I'm Community Injury Prevention Consultant with ACC.
And today we're going to take you on a needs assessment journey from thinking it was a good idea up until where we are right now. So what did we know? Well, it's not like we're starting from the beginning. We did have some data, and we did have a number of pieces of data from a number of organisations. This is ACC data, and it's telling us that that the home is where most of our injuries occur. It's also showing us the financial cost of the community. Nothing new here. In most communities, the picture would look fairly similar.
In this slide, this was another source of data, and it was from the Injury Prevention Research Unit in Otago University. This is a really useful tool for communities to drill down into fatal and non-fatal injury statistics. It was great for us. We wanted to look at specific causes of deaths between 2002 and 2012. While it gave us a picture of injury deaths, what we needed was the quantitative data to sit beside it, so we had the stories behind it. And that's where we decided we needed to look further.
So, as Sue and I've showed in the last two slides, we've been able to get some data. Each organisation has their own data and information about their own priorities. But what we needed was a picture of what was happening in our community as a whole, rather than separate pieces of the puzzle sitting with individual organisations. If we have all of the pieces of the puzzle, then we could fit them together to form a picture, and then a future we could all take ownership of.
So we decided that a needs assessment would provide the foundation for engaging partners, using the data to increase awareness and create a sense of ownership and shared responsibility. While we've undertaken the needs assessment under the Safer Wanganui umbrella, the intention is that it will become a community resource so we can all understand the issues in our community and determine what we can do collectively to improve the safety and well-being in our district. These are some of the areas that we knew that a needs assessment would address. We'd be able to identify specific types of injuries and look at population groups and the locations. We could prioritise programs, and that would help us work together as well. We could support the development of an evidence-based strategic plan and annual plan, which is our next step. We would also have baseline data to help monitor progress in reducing the incidence and severity of injury. And of course, the big thing was about empowering a collective understanding and commitment to a positive safety culture and create safer environments for everyone that lived within our district.
So so we presented a plan to Safer Wanganui. We've got some great people around the table, but we needed to contract someone who had the time and the expertise. Unfortunately, we're all really, really busy around our table, so we felt this was a priority. New Plymouth has been doing some needs assessment for the last 16 years, so we contacted their researchers. We found us some funding and set up a small group to work with the researchers on the priority areas. And then we gave them a list of identified key people for them to meet within the community. The trick is, how much do you look at and how many people do you talk to? This was funding dependent, but I think we got the right amount. We left them to it and we trusted the process. Some of the key areas that we looked at were injury deaths, hospitalisation for injury, ED attendance, ACC injury claims, road crashes, suicide, drowning and crime.
So we've just got the draft report back, and it's about fitting it all together now. And we've been really excited by what we've been reading. We've been challenged by some of it as well, and we just want to share this snapshot of the data. So we looked at the causes of injury-related deaths, and we could see that the three leading causes were falls, intentional self-harm and transport accidents. Altogether, these three accounted for almost 3/4 of the injury deaths among Whanganui District residents. And while we expected to see falls feature prominently in the stats, I guess this intentional self-harm percentage was a bit of a shock for all of us. 25% was more than we thought we would be looking at, and then that accounted for 1 in 4 injury deaths. When we drilled down a bit further to look at the top 3 causes and the gender, we could see that the leading cause of injury-related death for males was intentional self-harm. 46 out of the 152 male injury deaths over this 10-year period were from intentional self-harm, and that equates to about 30%. For females, self-harm fatalities were not as prominent, but nonetheless 16% of the 100 injury-related deaths were from intentional self-harm. Then we looked separately, and we haven't got a slide, but we looked separately at the age grouping, and intentional self-harm was the leading cause of injury death in the 25 to 44 age group and the 45 to 64.
So then we looked at hazardous drinking, and the definition of this from the Ministry of Health is an established pattern of alcohol consumption that carries a risk of the drinker's physical and mental health or having social effects on the drinker and others, e.g. road crashes, drowning, suicide, domestic violence, and then alcohol-related diseases like liver cirrhosis and some cancers. So this graph gives us a picture of hazardous drinking by age, and we can see that men were 27% were much more likely than women to be hazardous drinkers. Right, hang on, I'll bring up the other one, sorry. Men were 27% more likely to be hazardous drinkers than women. Men in the 15 to 24 year age group were 47% most likely to be hazardous drinkers. This is 16% above the national average. So it's a little bit scary for Whanganui when we think about that. When we look at the people aged 15 to 24 age group, we were really concerned, and I guess it's giving us a real picture of where we need to be targeting when we're thinking about drinking in our community. Sorry. So where to next? Well, we've presented our draft findings to Safer Whanganui Steering Group, and we've had a subgroup meeting that have looked at some of the some areas that we just want some changes in the report. We've got a few areas that need tidying up, and we've got some areas that we just want some clarification on. Once we get the final report, it will go to the Council Strategy and Policy Committee for sign-off, and then we'll launch this in the community and share it with everyone. It'll be on our website, and it'll be on our partners' website as well. We want this to be a community resource so that anyone has the opportunity to use the information that's in the report. We're then planning to workshop this with Safer Whanganui and come up with our agreed priorities to focus on. It has enabled a shared understanding and a shared focus. Now we know this stuff, we can't unknow it. And it's a call to action for all of us and a shared responsibility. So do we have any questions?
Thank you, Lauren and Sue. Thank you for sharing your experience. If anybody has any questions for Lauren and Sue, please use their email contact details on this last slide, or you can direct queries through the Safe Communities Foundation New Zealand and we can pass it on. Thank you, and I hope you enjoyed the webinar.